fine. Good day, everyone. My name is Colette Curlew, and I'm the Director of the Client Services Department at the National Council on Drug Abuse. What do we do here? We gather data first of all, right? So we go around the country and we look at best practices around the world to decide on what would be best for Jamaica and the context that we operate in. And we use that information to guide policymakers in making legislation, in coming up with standards, and also in developing policies. And we use the best evidence that's out there and the best practices and what the data says to drive our prevention and treatment programs. And we do training because we can't do it without the help of persons in communities, and our stakeholders and partnerships with different organizations. So we also train persons. And we implement these evidence-based prevention programs in schools, in communities, in workplaces. And a big part of what we do is public education. So we're using the social media platform mainly now because schools are closed and we have limited access to them, and also the traditional media to do the public education.
Okay. So what is this campaign about? The Good Ganja Sense campaign. Please tell me a little bit about that.
We recognize. Can you imagine that we have been saying what is not good about ganja, but there are some good things about ganja. Absolutely. And that's what this campaign is about, informing you about the facts about ganja, and then hopefully you'll make informed decisions regarding that. And as I'm stressing again, that the good thing for us is the medicinal part of it, and more research to be done so that we can know beyond a shadow of a doubt that this is what is important and critical for the public to know about ganja. This is how you're to use it. We are against smoking generally, tobacco, or ganja, because of the harmful effects it has on the body.
Right, okay.
So we would rather that it be done according to the prescribed, I'm using the term, what's the word? With lots of reservations.
With lots of reservations, okay, well.
Because smoking is not good. So the medicinal use of it would be through tinctures and maybe taking out the THC, using the CBD oils and other methodology, the cannasol and those things are what the preferred method is. But we recognize the rights of persons to choose.
Right on.
And that's something that we are learning and practicing more harm reduction as well, so that you are aware that, and I hear the buzzword is coming up again, that people can become addicted. That's coming up again to it. And so we would want persons to be more deliberate and selective in the use, and
more intentional, to use with intention, not just kind of willy-nilly. As people are accustomed to, I mean, because it is a part of the culture, the consistent use of cannabis. You do have a challenge ahead of you. So, I mean, what type of challenges have you been facing when you do approach entities, organizations, people like the CLA and so on, to say, look, we need to educate people? How has that been?
So we are all for it, and the project goal is to improve this good ganja sense, because that's the name of it. The overarching goal of this project is to improve ganja literacy among the Jamaican population, to strengthen the capacity to make good choices about ganja use. Right. The components of it, and I'll answer that question, is project management. You have to manage a project. Then you do mass communication. We hope to have a big mass communication campaign out there. And we want to do school engagement. So we're looking at the policy school. We're trying to build a peer leadership and their capacity to lead, and by example and also by choice, and show their peers how to operate. And what we realize is that there's a family component. So we're trying to build a family bonding and communication so that children can thrive rather than strive within their families and communities. And we want the communities to protect the children.
Of course, right on. So, all right, so that's okay.
We are
Go
doing
ahead,
this
go
in
ahead.
partnership with other organizations
All right.
because the first phase of it that we did in about 3 years ago was know the facts, know to act. And what was hoped
Okay.
in that round of it when it was launched, and that was shortly after the 2015 decriminalization and the amendments to the DDA, was that we would have different target groups being market segmented and have messages for them, the farmers, the growers, the tourists, the schools, communities. We had the different, but the funding did not come through for this. So what we did instead now was to focus on the youth. And so when we had focus group meetings with them, they said, tell us the truth and give us the facts, and then we will know how to act. So that's how we came up with it, talk the truth. And we did
Right.
that campaign for about 2 3 years, and now we're doing a new phase of it now. We call this phase 3. And this the media component, we're going to have social media component because that's where everybody is at now. We're going to have
Everything's
radio,
online.
yeah, radio and TV ads. We're going to have billboards. We have a jingle that I'll play for you as well.
All
We're
right.
still going to continue. I'm going to
Oh
play the
yeah, no,
jingle.
I was gonna get to that. We can help you significantly with the media creation as well as, of course, the campaign, getting it out there to people. That's where we are definitely that format.
This
I was gonna
this
ask precisely that. Well, what are the components? What's the messaging that you're giving? Okay, is this back to
So
screen
we're
for you?
still developing the messaging, right?
Yeah.
But the
Right.
theme of it is good ganja sense. We will have specific messages targeting different groups coming up. But can I play the jingle for you then now?
Please go ahead. As long as you can hear it, please go ahead. I'll give you.
Yes, I'm going to play the jingle for you now so that at least you see where we're at.
All right, the messaging, because that's what's most important, of course, the messaging.
All right, so I'm going to play this for you now, and then you can share sound, okay, on this screen. Okay. Well,
There you go.
Good ganja sense. Learn more your ganja, just be smart with it. Good ganja sense, good ganja sense. We have many uses for the cannabis. Knowledge is power, youths we need that. Ganja smoking and no pitney thing that. Commercial ganja you farm then you reap. Entrepreneurs and scientists say. Good ganja sense. Learn more the ganja, just be smart with it. Good ganja sense, good ganja sense. We have many uses for the cannabis. Be smart with your ganja, go get a permit. Ganja full of uses, make sure you learn it. Make me tell you, can a solid make for eyes. Ganja can boost lives. Good ganja sense, good ganja sense. Learn about the ganja, just be smart with it. Good ganja sense, good ganja sense. We have many uses for the cannabis.
This Good Ganja Sense message is brought to you by the Ministry of Health and Wellness and the National Council on Drug Abuse.
What I'm appealing to Jamaica to do is to protect our children. Please, please, please protect our children. Do not sell it to them. Do not give them access. You see videos floating around with children using and being promoted as them turning man now. It's not a rite of passage for children to get it. Please, just protect our children. Let's keep it out of their hands until they're 18. And if you're using, use wisely.
Right. All right. Well, on that note, I think we can wrap it up. Thank you very much for joining us. We've had a great conversation. Thank you for the presentation. We fully support what you're doing. I think what you're doing is a great thing, and we'll speak to you again.